Welcome to Illuminating Health, the UCSF School of Nursing podcast that sheds light on health and healthcare issues affecting our daily lives. My name is Yari Suarez, current student in the Family Nurse Practitioner specialty, and today I'm joined by Andrea Kuster, Associate Clinical Professor, and Tasha Toliver, Manager of UCSF's Health Office Population Health Outreach Team. Thank you both for joining today's episode.
Thanks for having us, Yari.
Thank you for having us.
Despite medical advances, the United States continues to have the highest rate of maternal deaths of any high-income nation. Additionally, many of our nation's pregnant individuals and their infants, especially those from low-income and underrepresented groups, do not have access to quality health care. Andi, Tasha, and a team of colleagues are working to change that. They are leading a program that provides comprehensive and individualized healthcare services to publicly insured pregnant patients in the San Francisco Bay Area. Andi, please tell us about this care model.
Sure. Thank you so much again for having us. I am excited to talk about our program at UCSF Health, which serves pregnant patients with public insurance who come from all parts of the San Francisco Bay Area, primarily San Francisco itself. Our program is centered around the Comprehensive Perinatal Services Program, known as CPSP, which is actually a Medi-Cal benefit. And this program is equity-centered in that it provides health education, nutrition, and psychosocial support services in addition to the routine obstetric care that we usually provide. And our institution is a longtime CPSP provider, but we discovered that UCSF Health's publicly insured prenatal patients weren't consistently and systematically receiving these comprehensive services aimed at improving their pregnancy outcomes. So in fact, by 2020, it was only our family nurse practitioner faculty practice in the OB department that was consistently offering the program. One of our physician colleagues, Dr. Malini Nijigal, she took the initiative to convene a work group to kind of examine how we were providing services to OB patients with Medi-Cal. And the group came up with a number of recommendations to create a more patient-centered and community-connected system for structuring the program and delivering the program. And they really emphasized that it had to be an equity-focused approach, that would be essential in addressing the structural inequities that result in disparities in perinatal care access, experience, and outcomes. And so it took about a year to obtain stakeholder buy-in for a proposal that included integrating our School of Nursing faculty practice further into the OB department while embarking on a collaboration to improve comprehensive perinatal services throughout the department. And then the Office of Population Health joined about 6 months later, and we began to design new systems to ensure maximum implementation of the program. So all pregnant patients with Medi-Cal enrolled in prenatal care at UCSF Health are eligible. So far, about 150 have enrolled, and we have a lot of work to do to strengthen our enrollment efforts to ensure that the program is indeed offered to all eligible patients, because there are many more patients with Medi-Cal than that 150. Once offered, the patients usually accept and complete the program. They are offered it by a scheduler at the time of scheduling their first prenatal care appointment. They are also scheduled for a video visit with a healthcare navigator from Population Health. And that healthcare navigator will begin to meet per trimester with the patient via video visit to complete what are called the CPSP trimester assessments. But they will always start out with offering the menu of prenatal care options that are available to patients at UCSF Health, including care by midwives, nurse practitioners, obstetricians, group prenatal care, and always prioritizing continuity, language concordant care, and racially concordant care through the Black Wellness Clinic and the Embrace program. And then they will work systematically to offer community resource referrals to all patients, including public health nurse home visiting, WIC supplemental nutrition program, dental care, and doula programs in the community. And patients are also referred to the Pregnancy Pop-Up Village, which is a kind of a one-stop model community-based monthly event where they can directly enroll in all of these services too. And then additional needs-based referrals are also made, including the homeless prenatal program and to primary care providers. We want to make sure that patients who decline enrollment in the program are still offered community resource referral. And that would happen then not by the healthcare navigator via the video visit every trimester, but by the clinic-based team of providers, medical assistants, and nurses.
Tasha, you manage a team of healthcare navigators who are essential to the success of the care model. What type of services do the healthcare navigators provide to patients?
Absolutely. Our healthcare navigators play a crucial role in supporting patients in the Comprehensive Perinatal Services Program. They focus on engaging patients who have public insurance and guide them through the program by completing 4 detailed trimester assessments. And beyond that, they go the extra mile by connecting patients with community resources through referrals and warm handoffs. Their work empowers patients and addresses all of their psychosocial needs, making this journey as smooth and supportive as possible. It's all about putting patients at ease and helping them feel confident and cared for during this most important and vulnerable time of their lives. Patients often have shared how much the healthcare navigators have helped them. One even said, "You got me through my pregnancy. I didn't have anyone else." Another mentioned, "This is my 3rd pregnancy, and I have never felt so supported." One patient even said, "I feel so much better and wish I could have started my entire pregnancy with you all." These messages show that our navigators provide more than just practical help. They offer comfort, trust, and vital support during an important time in patients' lives.
In addition to healthcare navigators and clinic based staff and providers, the team includes a dietitian and a social worker. Please tell us more about this interprofessional team.
Yeah, thanks, Yadi. We are actually super proud of our interprofessional team because that is what makes this program work. So in terms of the dietitian and the social worker on the team, their time is dedicated specifically to this population of publicly insured patients. So that way referrals can flow directly and needs can be addressed promptly. And the healthcare navigators will offer all patients a referral to the dietitian and referrals to the social worker as needed. In addition, another member of our interprofessional team is the advanced practice nurse student. So Family Nurse Practitioner faculty regularly precept groups of advanced practice nursing students in our clinic. So with expert supervision by their preceptors, students provide high quality individualized care while developing patient-centered and trauma-informed advanced practice nursing skills. Through their clinical placement rotation, they apply what they've learned and or they bring from their diverse lived experiences about social determinants of health and a structural competence framework for addressing them. This training is consistent with the School of Nursing's commitment to develop a diverse and representative clinician workforce that is prepared to address health disparities and inequities head on. So Yadi, I have a question for you. As a nursing student, you completed a clinical placement in our clinic. What was your experience with the Comprehensive Perinatal Services Program?
Thank you, Andy. Yes, as a student family nurse practitioner, I found that having the note from the Comprehensive Perinatal Service Program in my patient's chart provided an important snapshot of their background. It helped me to provide a more efficient and focused visit because I knew ahead of time the barriers that my patient was facing, and I could tailor my visit to help also address those issues. I also believe the CPSP note enhanced my ability to provide holistic care within the limited time I had with my patient. By having an insight into their personal and social economic circumstances, I could better support my patients as a whole individual rather than simply addressing their medical concerns. This approach, I felt, helped me build a more compassionate connection with my patients.
I really appreciate your sharing your experience, Yadi. It really emphasizes the importance of that interdisciplinary team and how the provider and the healthcare navigator need each other in the care of the patient. And I am inspired to hear about what you learned and what your experience was like. And I'm excited to think about you completing your family nurse practitioner program, graduating and going out into the community to continue to develop programs like this that serve the needs of our diverse populations.
Yes, Yadi, it was amazing to hear how the note of the healthcare navigator is so helpful for you to do your work, and also it allows you to prepare when you're meeting with your patient and making them feel that they are being heard. So having that story prepared ahead of time is a very amazing for I'm sure for you and as well as the patient, for their provider to know a little bit more about them that they really didn't have time to divulge during their visits.
Thank you, Andy and Tasha, for your comments. And yes, I agree that the CPSP note did help me understand my patients as an individual better and help me provide more quality healthcare service for them. The program in its current form has been in place for nearly 2 years. What outcomes is the program having for patients and for healthcare providers?
I feel really excited about some of our preliminary outcomes. In the first year, we had kind of a small pilot program with the patients of 3 to 4 providers, and then we opened up to all patients about 7 months ago. And I think I just want to highlight as one of the positive outcomes, kind of reiterate what Yari was saying about when patients have met with the healthcare navigator before their first prenatal care visit. Many of their needs and strengths have been identified, upon which then the clinic team can continue to build their relationship, which is so important to being able to provide high quality perinatal care, an environment that inspires trust. Initial data comparing patients enrolled in CPSP to those who aren't is showing higher exclusive breastfeeding rates at the time of the postpartum assessment with the healthcare navigator, a higher rate than the San Francisco County rate of exclusive breastfeeding at 1 month after delivery. So that postpartum assessment with the healthcare navigator occurs sometime within the first 6 weeks postpartum. So those measures can be compared. The rate of any breastfeeding at postpartum assessment is lower than the San Francisco rate of any breastfeeding at 1 month postpartum. And this is consistent with lactation disparities that we've seen in our institution and across our state and nation. And we're continuing to address these inequities and disparities as an institution that has baby-friendly hospital designation to support lactation. And as I mentioned, although we're still working on kind of refining our data analytics to make sure that our metrics are being measured accurately, it does appear that our exclusive breastfeeding rate at hospital discharge for those patients enrolled in CPSP is almost 20% higher than among those patients with Medi-Cal not enrolled in CPSP in our institution. And our postpartum follow-up rates appear to be twice as high among enrolled patients compared to those who are not enrolled. This really speaks to our need to continue to focus on ways to offer the program more consistently to more patients, thus enrolling more patients so that they can benefit from the additional supports provided through the program.
Other things that are yielding to be beneficial is just the collaboration with community. Being a part of this work and our healthcare navigators really learning about all of the community-based programs that provide this support for patients that a lot of patients are unaware of. So, this program has allowed us to get more information about upcoming community programs and how they are expanding in different communities, not just for publicly insured, but people who don't have medical insurance at all, and how they could support. So it allows us that if we encounter other patients, that we can use these community resources for other patients who may be experiencing inequity in care.
What has been a highlight of this work for both of you?
A highlight for me has been seeing how our work has strengthened relationships with community-based organizations. Partnering more closely with these groups has really enhanced the support we're able to provide to our patients. For instance, we've been able to create more effective referrals and warm handoffs, ensuring the patients are connected to the resources they need seamlessly. This has built trust not only with our patients, but also with our partners who see that we're all working towards a common goal of comprehensive care. and expanding and working with the different providers to see how well we work together across so many areas in UCSF and other organizations, that they provide us the feedback to say that they really appreciate the work that is happening behind the scenes as their patients are now being more responsive to the care that they're receiving, and having better outcomes.
Wow, I totally agree with Tasha that the collaboration is probably one of the highlights for me, both within and outside of our academic health center. As an old public health nurse myself, it's just hugely gratifying to be a part of strengthening those connections with resources that will likely, kind of continue to be a part of patients' lives far longer than I will be as their prenatal and postpartum care provider. I also feel like within that collaboration internally, that opportunity to work more closely with other departments within UCSF Health that have the same goals, and that we can, through this collaboration with the Office of Population Health, essentially be doing public health within our institution while continuing to train students to have that experience to take with them as they go out to be members of the community health workforce. I also feel like a highlight for me has been really understanding how small tests of change can really make a difference. So when I think about a small test of change quality improvement project that we did to see whether or not adding an earlier postpartum visit for folks with publicly insured patients, which is consistent with guidelines but rarely implemented. The 6-week postpartum visit is still the traditional standard of care. But by doing that small test of change and noting that postpartum follow-up rates improved, we were able to take that to the larger system, institution, stakeholders, and say, we have this small test of change. Give us a chance to try it at a larger level. We've now added that routine early postpartum as well as the traditional 6-week postpartum follow-up visit for all patients. And our postpartum follow-up rates appear to be double in the enrolled, in the group of patients who are enrolled in CPSP. So that has been powerful for me, is just to really be patient with those small tests of change or those small tweaks and things that we try, so that we can kind of gather the data, the information that we need to be able to convince stakeholders and systems that it's worth changing the system. And as mentioned at the top of the podcast, US pregnancy-related mortality rate is higher than most other high-income countries, 2 to 3 times higher, in fact. And our country is the only one without universal health care among that group. African American folks are disproportionately affected, with the pregnancy mortality for Black individuals about 3.6 times higher than the mortality rate for white individuals. And most of these deaths are preventable. And most of the causes are exacerbated by other health disparities and inequities. American Indians and Alaskan Native and Pacific Islanders also report the lowest access to prenatal care. Now, interestingly, almost 2/3 of these pregnancy-related deaths actually occur during the first year postpartum, and about half of those occur in the first 6 weeks postpartum. So when I highlight the importance of postpartum follow-up care, it is an area that has been neglected and really has so much potential for impacting people's lives going forward in terms of providing lactation support, which we know results in benefits, lifelong benefits for birthing people and children. Also opportunities for family planning before folks leave the postpartum space, as well as any disease management that might need to be attended to, prevention of disease through any healthcare maintenance screenings like cervical cancer screening or anything else that might be due for the patient, as well as other health promotion.
Thank you, Andi and Tasha, for joining us on this episode of Illuminating Health. And thank you to our listeners. We look forward to connecting with you next time.